Medicaid. It's more than just a program. It's a lifeline for millions of Americans. It's a lifeline for millions of Americans, providing essential healthcare services to those who need it most. From children to the elderly, Medicaid ensures that the most vulnerable among us receive the care they deserve, providing essential healthcare services to those who need it most. But this vital safety net is under constant threat from fraud. Fraudulent activities not only drain resources but also jeopardize the health and well-being of those who depend on Medicaid. That's where Medicaid Fraud Control Units, or MFCUs, come in. These specialized units are the frontline defense against those who seek to exploit the system. These dedicated teams work tirelessly to investigate and prosecute those who would exploit the system for personal gain. Their efforts are crucial in maintaining the integrity of Medicaid. Overseen by the Department of Health and Human Services Office of Inspector General, MFCUs serve as guardians, ensuring that Medicaid funds reach those they are intended to help. They work diligently to uncover fraudulent schemes and bring perpetrators to justice. Every year, MFCUs across the country expose and prosecute countless cases of fraud, recovering billions of taxpayer dollars. Their work not only saves money, but also restores trust in the system. Their work is vital, protecting not only public funds but also the health and well-being of vulnerable individuals who rely on Medicaid. By safeguarding these resources, MFCUs ensure that Medicaid can continue to provide for those in need. 2024 proved to be a banner year for MFCUs, with a record number of convictions and recoveries. Their relentless pursuit of justice has made a significant impact, ensuring that Medicaid remains a reliable source of support for millions of Americans. The numbers speak for themselves. In the world of Medicaid fraud, 2024 has been a landmark year, setting new records and sending a clear message to fraudsters everywhere. In 2024 alone, Medicaid Fraud Control Units, or MFCUs, secured over 1,200 convictions. These convictions span a wide range of fraudulent activities, from billing for services not rendered to more complex schemes involving multiple parties. Additionally, MFCUs reached over 800 civil settlements or judgments. These settlements often involve hefty fines and agreements to cease fraudulent practices, ensuring that justice is served and deterring future misconduct. This relentless pursuit of justice resulted in a staggering $1.5 billion recovered from fraudulent activities. This recovery is not just a number, it represents funds that can now be redirected to legitimate healthcare services, benefiting those truly in need. These figures represent a significant increase from the previous year, highlighting the growing effectiveness of MFCUs in combating Medicaid fraud. The comparison between 2023 and 2024 shows a clear upward trend in both convictions and financial recoveries. To put this achievement into perspective, let's look at the corrected figures from 2023. While 2023 was a strong year, the strides made in 2024 are truly remarkable. The HHS OIG reported a total of 2,112 exclusions, which include individuals and entities barred from participating in federal healthcare programs due to fraudulent activities. Of these exclusions, 795 stemmed directly from MFCU cases. This highlights the critical role that MFCUs play in identifying and prosecuting fraudsters. This means that MFCUs were responsible for over a third of all individuals and entities barred from participating in federal healthcare programs that year. Their efforts are crucial in maintaining the integrity of Medicaid and other federal healthcare programs. The message is clear: MFCUs are stepping up their game, and those who engage in Medicaid fraud are facing the consequences. With each conviction and settlement, the deterrent effect grows stronger, making it increasingly difficult for fraudsters to operate. One state that exemplifies the impact of MFCUs is Ohio. In 2024, the Ohio MFCU received over $20 million in combined federal and state funding, demonstrating the commitment to fighting fraud at both levels. This investment has yielded significant results, with the Ohio MFCU uncovering and prosecuting a range of fraudulent schemes. From billing for services never rendered to falsifying patient records, the cases handled by the Ohio MFCU reveal the depth and breadth of Medicaid fraud. Let's take a closer look at some of the individuals who felt the full force of the Ohio MFCU in 2024. Their stories serve as stark reminders that Medicaid fraud is not a victimless crime. behind the numbers are real people whose greed and deception have real consequences. Doretha Irby, owner of Loving Hearts LLC in Columbus, was sentenced in July 2024 for Medicaid fraud and forgery. Irby, entrusted with providing care for vulnerable individuals, chose to betray that trust for her own financial gain. Her scheme involved creating false timesheets, billing Medicaid for services that were never provided. This calculated deception allowed Irby to pocket thousands of dollars from the program. The court, however, saw through Irby's deceit. She was sentenced to 5 years of probation, a suspended 10-month prison sentence, and ordered to pay back over $13,000 in restitution. Irby's case serves as a cautionary tale. MFCUs are watching, and no amount of deception can hide from the pursuit of justice. Section 5. Lisa Laurent and Margot Willis. Betraying trust for personal gain. The Ohio MFCU also took action against individuals who exploited their positions of trust within the healthcare system. Lisa Laurent, a nurse in the Columbus area, was indicted in July 2024 on charges of theft, illegal processing of drug documents, and forgery. Laurent allegedly abused her access to prescription medication, stealing hydrocodone and altering records to cover her tracks. In a separate case, Margot Willis, owner of Paramount Development Association in the Dayton area, was indicted on charges of Medicaid fraud, theft, falsification, and tampering with evidence. Willis allegedly billed Medicaid for unqualified staff and provided false documentation to support her fraudulent claims. Both Laurent and Willis are now facing the legal ramifications of their actions, thanks to the diligent work of the Ohio MFCU. Aki Ferguson exploiting addiction for profit. Perhaps one of the most egregious cases involved Aki Ferguson, owner of the Light Recovery Center in Cuyahoga Falls. Ferguson was indicted in July 2024 on charges of Medicaid fraud and theft for allegedly submitting false claims for addiction recovery services that were never provided. By preying on vulnerable individuals seeking help for addiction, Ferguson's scheme resulted in an estimated loss of $850,000 to the Medicaid program. Ferguson's case highlights the devastating impact of Medicaid fraud. Not only does it drain resources from those who desperately need them, but it also erodes trust in the healthcare system as a whole. The Ohio MFCU's swift action against Ferguson sends a clear message: exploiting vulnerable individuals for profit will not be tolerated. The high cost of Medicaid fraud, more than just dollars and cents. The impact of Medicaid fraud extends far beyond the financial. When individuals and companies defraud the program, they are not just stealing money, they are stealing healthcare. They are stealing access to life-saving treatments, essential medications, and critical support services. For every dollar lost to fraud, a vulnerable individual is denied the care they rightfully deserve. Moreover, Medicaid fraud undermines the integrity of the entire healthcare system. It erodes public trust, creates an uneven playing field for honest providers, and diverts resources away from legitimate healthcare needs. The fight against Medicaid fraud is not just about recovering money, it is about protecting the health and well-being of our most vulnerable citizens. MFCUs, protecting taxpayer dollars and vulnerable patients. The work of MFCUs is essential in safeguarding the integrity of the Medicaid program. These dedicated professionals are on the front lines, investigating and prosecuting those who would exploit the system for their own gain. Their efforts not only protect taxpayer dollars but also ensure that Medicaid beneficiaries receive the quality care they deserve. The success of MFCUs in 2024 demonstrates the impact of their work. By aggressively pursuing cases of fraud and holding perpetrators accountable, MFCUs are sending a clear message: Medicaid fraud will not be tolerated. Their dedication and commitment are instrumental in safeguarding the Medicaid program for those who rely on it most. The fight continues, strengthening efforts against Medicaid fraud. While the achievements of MFCUs in 2024 are commendable, the fight against Medicaid fraud is far from over. The landscape of fraud is ever evolving, with new schemes and tactics emerging regularly. This means that the efforts to combat these fraudulent activities must also evolve and adapt. As fraudsters become more sophisticated in their schemes, MFCUs must constantly adapt and enhance their investigative techniques. Increased funding, advanced data analytics, and cutting-edge technology are essential tools in this ongoing battle. These resources enable investigators to detect and prevent fraud more effectively. Interagency collaboration is also crucial to staying one step ahead of those who seek to exploit the system. By working together, different agencies can share information and strategies, making it harder for fraudsters to slip through the cracks. The fight against Medicaid fraud requires a collective effort. Public awareness campaigns play a significant role in educating the community about the signs of fraud and how to report it. Proactive reporting of suspected fraud by individuals is a critical component in this fight. When people know what to look for and feel empowered to report suspicious activities, it creates a powerful deterrent against fraud. Continued support for MFCUs is vital to protecting the integrity of the Medicaid program. This support includes not only funding but also legislative backing and public endorsement. By working together, we can ensure that this vital safety net continues to provide essential healthcare services to those who need it most. The integrity of the Medicaid program is crucial for the health and well-being of millions of Americans. The fight against Medicaid fraud is a fight for justice, a fight for accountability, and a fight for the ethical use of public funds. It is about ensuring that resources are used for their intended purpose. Ultimately, it is a fight for the health and well-being of our nation's most vulnerable citizens. By safeguarding Medicaid, we protect the promise of healthcare for all who depend on it.